Good afternoon. For those of you who don't know me, my name is Patrick Kelley. I direct the Board on Global Health here at the Institute of Medicine, which is the unit that sponsors the forum. Over the last several years, I've interacted with many of you in the course of forming this forum on innovation in health professional education. And I just want to tell you how thankful I am for the ongoing support from all of you, our sponsors and our members at large. Before introducing a true legend, Sir George Alleyne, I wanted to thank Matthew and Cynthia for co-chairing the planning committee for the workshop yesterday and today. Perhaps we can give them a round of applause. It's been a very, very provocative, informative event, and I think it's going to have legs down the line. And of course, I want to thank Patricia Cuff, who's the forum director, and Rachel Taylor and Megan Perez, who and all of the other support people. We've had a literally a platoon of IOM staff that have been working behind the scenes to ensure that this runs smoothly. So thank you all. And now I'd like to say it's a distinct honor for me to introduce a person who's been a friend of mine for over 12 years now. In global health, he's truly a legend, truly a transformative leader, and that's Sir George Alleyne. Sir George Alleyne hails from Barbados, a lovely country in the Eastern Caribbean, and began his career as an internist teaching at the University of the West Indies. He became more and more involved with the work of the Pan American Health Organization, and when I first knew him, it was in his capacity as the director of the Pan American Organization, and he served as the director from 1995 to about 2003. That was an exciting time for us. I remember spending some very happy moments with him in Trinidad as we were celebrating the 25th anniversary of the Caribbean Epidemiology Center. In 2003, Sir George retired, but certainly has kept very busy as the Director Emeritus. He worked with some of us on the Disease Control Priorities Project, helping to look at all of the health sector from a global health economics point of view. We also became very impressed with his efforts to help the United Nations a few years ago develop the second summit it has ever had on a global health issue, and that is the Summit on Non-Communicable Diseases. So George has really made a mark in a variety of areas, and I have also wanted to mention that the Secretary General of the UN has appointed him as his special representative for HIV/AIDS in the Caribbean. So across an array of clinical and global public health issues, Sir George Alleyne has been, for me, a hero, and I'm very, very happy to introduce you to him to reflect on the social contract that we've been speaking about over the last 2 days.